to the periaqueductal gray matter within the midbrain at the level of the inferior colliculus. If you can remember, the nuclei of the oculomotor nerve, they take origin from the same anterior location of the periaqueductal gray matter, but that is at the level of the superior colliculus. For the trochlear nerve, the nuclei lie anterior to this periaqueductal gray matter at the level of the inferior colliculus. So these axons from this nuclei, they pass around the periaqueductal gray matter and they cross out of the midbrain and go out of the midbrain to surround the lateral part of the midbrain. So also the other nucleus did the same thing, so that at the end there is a crisscrossing of these, axons or nerve fibers of the trochlear nerve at the back of the mid, that's a decussation at the back of the midbrain. So as these nerves, the trochlear nerves from either side, as they come out from the back of the midbrain, each of these surround the lateral side of the midbrain, and then each of these passes in between two great vessels, similar to the way the oculomotor nerve passes in between the two great vessels that form part of the cycle of Willis, which I will discuss later on. So these arteries through which this trochlear nerve comes out or lies in between the two arteries, similar to the way oculomotor also lies between the two arteries. The artery above is what we call the posterior cerebral artery. The other one below is what we call superior cerebellar artery. So this nerve is sandwiched between these two arteries, similar to the way oculomotor is also sandwiched. So each of these nerve passes through the cavernous sinus, similar to the way oculomotor nerve also passes through the cavernous sinus. So the oculomotor nerve lies above the trochlear nerve. So the trochlear nerve lies below the oculomotor nerve within the cavernous sinus. And then it gets out of the cavernous sinus and enters into the superior orbital fissure. From there, the nerve enters into the orbit to supply the superior oblique muscle. Are you clear? So this superior oblique muscle is responsible for, movement of the eye, downward and out. Are you clear? So much so that if there is a paralysis of this nerve, what is going to happen is that the person or the patient is going to have what we call diplopia. Because the person or the patient, if he or she wants to, bring his eyes downward and outward, there's going to be a there's going to be a diplopia. You understand? So he'll just be seeing two images at the same time. So because he cannot, move the eye downward and out, because the function of this superior oblique muscle is to depress the eye downward and outward. So that is the complaint the patient is going to, lay to you if he or she comes to you with the paralysis of the trochlear nerve. So the trochlear nerve is one of the thinnest, or I can say it is the thinnest cranial nerve among the whole top cranial nerves. And it is the only cranial nerve that decussate at the back of the brainstem, because others they also decussate within the brainstem, but this one is decussating at the back of the brainstem, and it's the only cranial nerve that comes out from the back of the brain stem. So that is all you people should get to know with regard to the trochlear nerve.